Hello, my name is Leila Kramer, Executive Producer for the National Library of Patient Rights and Advocacy. This is the winter of 2026. Unlike past winters, most of the country has received significant amounts of snow and experienced very cold temperatures. The roads and sidewalks are treacherous, and we are advised to take extra precautions when walking outside to avoid falling. According to the CDC, falls are the leading cause of injury for adults ages 65 years and older. Over 14 million, or 1 in 4 older adults, report falling every year. Falls are also the leading cause of injury-related death among ages 65 years and older. While right now we are all concerned about falling outside, walking to and from our cars, but falls can also occur in the home and workplace, and younger people also fall as well. Today, my guest is Dr. Brandon Chorzelewski, Clinical Director of JAG Physical Therapy in Hainesport, New Jersey. Dr. Chorzelewski received his doctorate in physical therapy at Alvernia University in 2023, and also did his undergraduate work at Arcadia University, where he graduated in 2017 with a degree in healthcare administration with a focus on clinical practice management. Today, we are going to learn some strategies that can help prevent falls at any age. Welcome, Brandon, and thank you for joining us today.
Thank you.
Though CDC statistics are frightening, what are some major injuries that you see in your practice from people falling?
So currently, some of the major injuries that I've seen in my experience have been hip and pelvis fractures, humeral head fractures, or rotator cuff tears, or sprained ankles, and also torn menisci. So it's always a lot of people that are either twisting, falling on an outstretched arm, landing and breaking either their shoulder or their hip.
So how can we all, regardless of our age, avoid falls? And what are some strategies that you can share with our audience today?
Yeah, a couple strategies I've learned is always to be aware of your surroundings, being able to notice a change in the surface or of the environment around the house. Let's say falls can arise from any loose wires, throw rugs, doormats, small animals, wet surfaces, and when you go outside you have the icy weather, icy roads, even within your parking lot of your community or within your neighborhood. Some strategies to avoid falls are to practice working on anticipatory and reactive postural control, meaning the ability to have the proper reaction time to any change in your body's own momentum or movement outside of your cone of stability, which is like one big ring around your body, and it's the feeling of when you're leaning too far forward, whether you have to use your hips to balance, take a step, just in order to regain your balance. Some of the exercises that I use for balance would be single leg stance, being able to stand on one leg, where you can start a little bit easier, called Romberg stance, and that's where you put both feet together and then you try to work on narrowing your base of support just to work on some of your sway to work on the cone of stability. Or a step in between the single leg stance and Romberg stance is a tandem stance, where you start to move one foot in front of the other, or you slowly glide in front of the other or behind, and that way you can start working on narrowing your balance. And even working on lower extremity or core strength to have the power and ability to move your body faster for a better reaction time.
And do you think that everyone should start having these types of stretches and exercises?
Mm-hmm. Yeah, could be a daily routine, working on kicking your leg out, working on getting out of a chair faster, being able to take steps quicker, using a counter surface, anything that's more sturdy, not like a sink that's only implanted in the ground. You want to make sure it has nice, so it doesn't have any give with you if you start to lean onto it, or even a lighter chair. You want to make sure it's a sturdy chair that has good weight to it.
Thank you.
Mm-hmm.
Now, Brandon, if someone feels like they are about to fall, what is the best thing to do in that instant?
So the best option, I would say, is during a fall to avoid injury is to first locate a stable surface if you can see one, or utilize one of those step strategies where you take a step out in front of you to create a wire base of support. That way you're not falling out on your arm, hurting your shoulder, landing on your hip the wrong way, or also cracking your pelvis. I've seen a lot of the older adults that have osteoporosis or osteopenia, they have a higher risk of getting more of those injuries.
Mm-hmm. Thank you. Now, I know, especially like you mentioned with older folks, wearing hip protectors give a person more security. What are your thoughts on people wearing them?
So I believe that they can assist with decreasing the force or amount of impact from a fall. Unfortunately, it is not a full solution to reduce the risk of falls, and some people may still not like to adhere to wearing them as needed due to their own fashion taste, or even if they're too bulky for their own clothing, if they have to wear like a bigger size just to compensate for the added padding. I also believe the risk for hip and pelvic fractures still may be prevalent due to more severe levels of osteoporosis in older adults, especially if their nutrition's not on the right regimen, then that may interfere with some of them, that they can still have balance issues, that they're still going to have repeat falls.
And in case our audience at home doesn't know what a hip protector is, can you explain a little bit what it is, what it's used for?
So a lot of the hip protectors of what I've seen, I haven't seen too many in my clinic now, but from what I've seen outside of my own research is it's kind of like a padding that hockey players wear. It kind of has different force padding that's around there's like different prominent bony structures of around your hip and your glute. That way it kind of gives you a big surface area to, when you land, fall, bump into different things, it is more of a shock absorption that kind of lessens the possible damage. And it's also been seen to reduce the risk percentage, or for risk for, for fractures.
Very good. Now let's focus on the most vulnerable patient population for falls, the elderly. What kind of preventative exercises and therapy do you recommend typically to strengthen the body for an older person and work on their balance?
Yeah, the exercises that I recommend to strengthen the body and increase balance in older adults include working on lower extremity and core strengthening, along with increasing one's cone of stability. The exercises that are mostly simple to replicate at home would involve knee extensions, being able to kick your leg out in a chair, working on your strength of your thighs, glute bridges where you lift your bottom off the table or bed if you're laying down. That works on your glutes and your hamstrings, and also sit-to-stands with an emphasis on power and quickness of being able to perform the movement, getting up and out of a chair quicker and quicker, and that also will involve in better reaction time, being able to activate those muscles in a quicker fashion. You can also go back to the tandem, Romberg, and single leg stance balance exercises, but always use something sturdy as a big chair, a strong counter or table. And then also balance exercises where you can add head movements, moving left and right, up and down, to also simulate outdoor environment.
Thank you. Now finally, there are evaluations that can be done by physical therapists that can assess a person's balance and strength and the risk of falling, whether they are an elderly person or they are a college athlete playing competitive sports.
Yeah, I would say a comprehensive evaluation from a physical therapist would involve assessing the strength throughout the lower extremities, as well as testing the limits in more functional tasks. This would include either manual muscle testing individual muscles to kind of isolate to see if there's any weakness throughout the body. There's also different outcome measure tools as the 5-time sit to stand, where within, if you go sit and stand 5 times, you have a certain duration and you use that time limit to see the risk of falls. And then there's also the 30-second sit to stand. That is a good strength and endurance indicator. And then you also do the overall balance assessment in various foot positions. You would test the balance levels with eyes open, eyes closed, and to evaluate the use of vision, somatosensory, and the vestibular function, because those are the 3 systems of the body that all incorporate into our balance. And both can be evaluated in the elderly and of the collegiate athlete. However, the intensity of the examination or the evaluation will differ.
Makes sense. Well, thank you, Dr. Brandon
You're welcome.
Chorzelewski, for being my guest. This has been a very interesting conversation.
Absolutely.
I'm Leila Kramer for the National Library of Patient Rights and Advocacy. Thank you so much for joining us.
Thank you.